Hi, everyone. I'd like to do a shout out to our sponsor, Bacco Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Bacco Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of their clients, Bacco Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the position. Bacco Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Bacco Diagnostics services, get started today by sending an email to corporaterelations@baccodiagnostics.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the co-host for the Dean's Chat podcast. Once again, I'm joined by my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
You know, I'm doing fabulous. I'm kind of counting down the days here before heading out to the Western.
Yeah, absolutely. We're getting everything packed here, getting everything ready for lectures and for kiddos. It's a little bit of an interesting mixed bag, but it's going to be great.
Hey,
Did you have a nice Father's Day?
Oh my gosh, I had a great Father's Day. Thank you.
Oh, good.
Yeah, nothing's better than being a dad. That's fantastic.
Yeah.
So thank you for asking. I was going to say you can't go to Disneyland without your kids. So there you go.
No, not at all. Yep. So.
All right. Sounds good. Hey, we have a wonderful guest today. I would like to introduce Hoa Phan. Dr. Phan, welcome to Dean's Chat.
Well, thank you for having me.
Well, you know, we're pretty informal on Dean's Chat, so if it's okay, let's go first names. Hoa, Joanna, or Joe, I should say, and Jeff.
I'm in trouble if it's Joanna. So
that's true.
Well, thank you, Jeff and Joe.
It sounds good. Let me give you a little more formal introduction. Hoa went to podiatry school at Temple University School of Podiatric Medicine. He followed that up with 3 years at the Cape Fear Residency in the inaugural class. And then upon completion of his residency program, he became a fellow at the University of Texas under the guidance of Dr. Lee Rogers. We got a whole lot of things to talk about today, Hoa. Thanks again for joining us. And we got lots of initial questions. Joe, I don't mind kicking it off. First and foremost, why did you decide to do a fellowship? That's usually a hot topic in our profession, and love to get your take on that.
Okay. I decided to do a fellowship because despite being in the first class of my program, and I got a lot of pushback for wanting to do a fellowship, actually.
Oh, really? Okay. Now this is getting spicy already.
Our chief of podiatry was asking me what more could you want to do, and I thought that was pretty apt because we did a lot of things. We were, despite being like a trauma 3, we were top 10 in ED encounters in the nation, and so we were pretty busy. And so I wanted to put a lot of my attention into different things for limb salvage, whether it be local flaps, regional flaps, and then frames. And this has been kind of a critical year because this is kind of the first year where we've been doing the transverse bone transport for CLTI, and we've had pretty good early success with that. So that's another technique in the bag for, say, if you ever wanted to join like a hospital practice. So I remember at the end of my first year, we had done a reverse hernias brevis flap, and I thought it was the most cool thing ever. And my attending told me, you're going to have to find somebody to teach you these things. And so not even 2 months goes by, and Stephanie Oxman comes and lectures for us, and we get to dissect out a couple limbs. And then after that, I was able to go to Duke for flaps, and that's like a pretty good weekend course. So just honing in on my interest for things. In addition to that, Dr. Payday, my director, he's pretty keen on trying new things, and he does a lot of these kind of random flaps, and he's he's had pretty good success with a lot of them in a really, really diabetic population.
Yeah, I've heard that the backlog that Dr. Rogers discussed at the University of Texas was just huge. So there's no shortage of patients out there.
There really isn't, and they're just coming in. It doesn't matter if they had surgery across the street; they always find their way to UT.
Well, there you go. So, Joe, your thoughts on fellowship and additional training?
Yeah, this is not an uncommon thing that I'll hear sometimes from residents is, and certainly now, granted, I trained a long time ago, but I received the same kind of pushback is probably the best term, right? Like, oh, why do you need to do that? You don't need to do that, right? The air quotes need. So what I'm curious is, from your standpoint, when you started looking, you knew you wanted to do it and you had your own reasons for doing it. What did you start to look for? How did you start to narrow down what you were in? You'd said you were interested in some of the flaps. What was your criteria? Because there's lots of amazing programs now that are out there. What were some of the things that you were looking for in a fellowship program?
So there's plenty of good fellowship programs through ACFAS. All the arthritis centers, the OFACs of the world. But that didn't really fit what I wanted to do. And my director had known Payday from school. And so she gave me a very good referral, and now I'm here. But as far as things I looked for, it was kind of what kind of workload and how would that be distributed. Here's a unique program in that it's kind of intertwined with the residency program. So I get to teach and see if I like teaching before I go out there and do something crazy. It's, make this incision, color within the lines. It's hard to trust people with that.
So I have a question for you. What percentage of your responsibility as a fellow for 1 year, right? It's 1 year fellowship.
1 year.
What percentage of your responsibility was teaching versus being in surgery or clinic for that matter?
I'd say a third.
Wow, that's a lot actually. Good for you.
Yeah, that is.
Yeah. There's certain things I like teaching, so that's cool. And when I'm given that autonomy in the OR and there's nobody over my shoulder, I can actually I can play my music, I can teach, everybody's having a good time. Just somewhere where you can control the environment. But yeah, third.
Well, we're going to ask you later about the kind of music you play in the OR, because that's in this. You can't get out of a Dean's Chat interview without answering that. Okay. So save it just a little bit. Let's talk about the beginnings of podiatry for you. Where did you do your undergraduate degree, and what turned you on to podiatry?
So I did my undergrad at Temple in Philly. And it was one of those guidance counselors' offices, and there was a pamphlet for podiatry. And pretty soon I was able to find somebody to shadow. I think Temple had one of those summer internship programs where you go for a week at a time and see different things that people do. And so I thought the one doc that I shadowed had it pretty good. He was probably 70 at the time, and he was still kicking it. On top of that, he even did surgeries in his office. I thought that was pretty cool then, but now I think it's kind of bonkers.
I guess there's a spectrum there, right, of what people are doing in offices nowadays compared to years ago.
Yeah, but I mean, it was this very own procedure room. It's just so mind blowing to me. Just now, the things we take to the OR, and he's just willing to do it in his office.
Right, there you go. So tell us about the 4 years at Temple.
So my first 2 years of undergrad were in Australia, actually.
Oh, okay.
I it was like a Bachelor of Science, and then I did some Bachelor of Pharmacy because I was trying to get into undergraduate medicine. And the only school I got into was a very rural one. It was like 7 hours away from a Target. So I wasn't really keen on going to that one. So I transferred to Temple.
Very good.
And then I finished out the last 2 years at Temple, and yeah, I graduated on time. Only like 60% of my credits actually transferred.
Oh my.
I had a lot of catch up.
Wow. Talk about life-changing experiences. Joe, I went to a couple undergrads, and I thought that was harder than podiatry school sometimes based on the course load.
I can see that.
Yeah, and it's just such a different exposure, right? And your story was not uncommon either, and that sometimes it's something as simple as a flyer was either in an office somewhere or left somewhere, or now someone runs across some Google search and like, what is this podiatry thing all about? Had you had any? So it sounds like you were a little interested maybe in some pharmacy. Were you interested in medicine? How did that medicine part translate into getting into that part with the counselor where you found the flyer about podiatry?
So I always knew I wanted to do healthcare, and I had two cousins that were both pharmacists, and I thought if they can do it, I can do it too. And I was very wrong. But that's okay because I found this, and this is probably better. I always just knew that I wanted to work with my hands, and a position in primary care wasn't for me. And so that opportunity to do something surgical was very appealing to me. And I knew it was something that I wanted to work hard at. So I think that's why I ultimately chose podiatry.
And then were there skills or life experiences? Had you been doing things with your hands prior to this translation into medicine that you knew, like, I for example, like I was an art major before I started any of this, and I knew I loved working in that, using my hands in a much different ways, both lots of different mediums. But that translates very differently when you start thinking about something like surgery. Were there other things that you had life experiences or hobbies that have assisted or helped you?
So I'm an Eagle Scout, and we did a lot of woodworking.
Yeah.
I don't like it as much as I used to. Camping, I'd rather be comfortable, but I can still rough it. I think that's probably the one part of my life that I worked with my hands the most.
Okay.
It's interesting, wow, because we're at Midwestern University and it's a graduate level health sciences campus, right? And so I can't think of two professions that would be different than the pharmacy program and the podiatry program. I always think that, besides the DO program, our students are working within the DO program for their basic sciences, that dental is very similar to podiatry because it's hands-on, it's surgical procedures, it's in a smaller space. So I think that's interesting. You made the shift from pharmacy to podiatry. I think it's great.
John Evans did the same thing. So there is some precedent there for some other people that, again, were pharmacy mentality. And
Dr. Alan Boyk did it too, the dean at Kent.
Oh, there you go. Yeah. I didn't know. That's a fun fact about him that I didn't know.
Absolutely. Well, that's fascinating. So fast forward into podiatry school. First 2 years, basic sciences. Where did you do your clerkships, or how did that play out for you, and how did that influence where you went to your residency program?
So I did all my clerkships in the Northeast, and I ended up scrambling.
Okay.
And Cape Fear ended up being my first program that I ranked in the scramble, and they ranked me in a match. And about 3 weeks after match, I drove down to make sure it was a real program. I met my director, and she's like, "You have nothing to worry about. This is going to work." And I spent the day with my director and our chief podiatry, and that was a good day. it was the only setback I had was that when I left my car and it came back, it was covered in pollen.
Oh,
It's just coated in that yellow stuff. It was terrible.
oh man.
Well, speaking of new residency programs, I always say that the unsung heroes in our profession are those docs that are willing to step out and start a program, and all the attendings that bring their cases to that hospital to help train the residents. We've got the schools and people are in practice, but the people that are running the residency programs really make it happen. So my hat's off to Cape Fear, and they haven't been in the profession that long with a residency, but from my understanding, it's a very desirable residency.
Yeah, I think we're in our fourth, fifth year functioning.
And what was that like for you being the very first round to go? I was the second class for Midwestern, but that was at the student level. What was it like to be a resident in a brand new program?
I think a lot of programs say that it's like drinking from a fire hydrant, and it's probably really accurate. I didn't have seniors, and that was kind of nice. And then you realize that it's for like the first 2-3 months, it's kind of like the deaf leading the blind. It's because it's rough. We didn't quite understand how certain things worked, and they had their respective clinic hours but on their call days, they had like half a day to do cases and round with us. So they made the most of their schedules, and they incorporated that into having the residency, which was probably the most important part because we definitely needed supervision.
Did you have a co-resident or multiple co-residents?
Yeah. So we started out as 4, and then one guy left after like 2-3 months because he was homesick. And so it was 3 residents for essentially a program that was going to be a 4-4-4.
Mm-hmm.
And, we were plenty busy, but we got our act together around January. So, and that was nice. And, the moment we got that next class, we could really show them how we saw things and how we approach certain things. Because we took our jobs pretty seriously. Our nicknames were the hardest working interns, and we were in the ED within like 20 minutes of every consult. It was crazy.
Yeah, I would imagine that kind of added anxiety of being excellent at everything you're doing because you're the ones that are really making the name for the program since it's new adds a different layer to that experience. I mean, you're already kind of nervous as an intern doing things, but you have a chief resident or someone. Did you find you were leaning a lot on your attendings? Were they fairly supportive, functioning in that role as being essentially a chief resident and attending at the same time?
Yeah, my director actually rounded with us at like 5 a.m. for a couple days early on. And a lot of people, made sacrifices to stay on a little bit longer to, make sure that we were seeing the right thing and making sure that we were having the right kind of conversations with the patient about how their care was going to go on this course, because a lot of them didn't have the best education. And so we just wanted them to be confident in us, knowing that we had that support and knowing they were going to get the best care.
That makes sense. You want to do any shout outs to your residency director or attendings that kind of helped guide you along?
Big shout out to Chris McGinnis, Mark Eaton, Dan Lout, Bermudez, Thomas, and Terrell Brown, and Sandy Sheehan.
That's fabulous. No, that's fantastic. So let me ask you this: when you were in school and you were going through your rotations, before you got clinical experience, who are some of your mentors in the profession? And since then, who would you consider a mentor to you?
So in school first?
Yeah, school first and then after.
Okay. So in school, I really thought that, before rotations, I thought Dr. Kwasi Kwadu was really great, and I thought I could be something like him. And then after now, into now, it'd probably be Dr. Rodriguez, somebody that I pick his brain a lot. And then Ian Barron, he's our associate residency director here.
Oh, very good.
And then, of course, my director, Payday.
You had mentioned going to a workshop with Stephanie Oxman, and I think she trained with Dr. Rodriguez, I believe, when he had a fellowship.
Yeah, she did do that, and she's still in Chicago. I think she's still affiliated with that program. Yeah, that was great.
So I have a question for you. Now that you're in the last couple months of your fellowship, what is the environment? Looking for a position? You've been involved in academics. You've been involved in a fellowship. You've been involved in a residency. What are you looking for going forward in terms of advancing your career?
I'm pretty keen on finding a hospital-based practice, and I think that's where my skill sets are probably going to fit the best. I really do like limb salvage, and the value of somebody coming to the hospital with an infection and being able to walk out is kind of profound. They're not sitting around in a sniff for like months, or at least being able to treat something and then get back to it and see it through in that regard, not in a private practice setting, I think is where I fit the best.
That makes sense, though, with the nature of your fellowship and dealing with patients that are chronically ill with many comorbidities and foot responses that aren't your typical private practice kind of situation. That makes sense. You're probably super well prepared for that.
Yeah, I didn't have too much exposure to private practice, so it's not where I feel the most comfortable.
That makes sense. That totally makes sense. How about research? Well, I'm sorry, Joe, I'm sitting there hogging the interview here.
No, it made me think about the interview we had with Andy Masty, where he was talking about leaning into the things that you start to gravitate towards. So just like you said, well, private practice doesn't seem like it resonates with you the way the hospital-based practice does. And he was mirroring a very similar sentiment. And, figuring those things out in residency can be a little hard for some people. Do you feel like fellowship really kind of helped you get a lens of really what you want your practice to look like? Or did you start to get a little bit of a feel for that even in your residency program?
I got a feel for it in my residency.
Okay.
But we definitely do heaps of like limb salvage here as well.
Yeah.
And I guess my ideal practice would be probably even thirds of like limb salvage, trauma and recon.
Okay.
But like of the elective nature or otherwise. So I'm at the point where I still like everything.
Well, that's
a good place to be. Yeah, lots of flexibility. Sure.
Joe, your thoughts?
I'd love to kind of go in a little bit different direction, but before that, maybe we could do a quick shout out to our sponsors.
Absolutely. Let's give a shout out to Bacco Diagnostics. We all know that early detection is the most important determination in improving patient outcomes. Bacco Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Bacco Diagnostics, helping podiatric physicians keep America on its feet. Shout out to Bacco. Wow, they've been such a supporter of students, residents, practitioners for, I think it's been like 16 going on 17 years. So we'd like to give them a shout out.
So I'd love to transition a little bit, actually back to something that you had said, because I think this is something that is a little bit anxiety provoking for some students. When you start trying to pick ranking programs and then this concept of going through the scramble, if you'd be willing to talk a little bit about that, because we know a lot of outstanding podiatric surgeons that scrambled, they made it through, they're going to be okay. What advice would you give a student who finds themselves in that? We're a little far out from the match right now, but next year in March, there'll be this new group that are going through that anxiety period of trying to figure all this out. What advice would you give to them?
I would say first take a breath. I found out around like 11, and I was at the gym, and it was not as bad as my co-resident who just had his baby the day before. Because the requirement to be in the inaugural class is you had to scramble.
I did not know that.
Interesting. Yeah.
Because we all scrambled. First, I would say take a breath. There's lots of programs out there that are, if you're that would be happy to have you, that would benefit from having somebody decent. I would recommend ranking more than 10, because I only ranked 3, and that was perceived as really risky. But I only ranked 4 in the normal match, so I didn't learn my lesson. So I'd rank a healthy amount. I would field every phone call that you get, because I was up till must have been like 10 o'clock at night getting calls from all these people. Because there was programs looking for 4 spots, looking for like 1 spots. There's so many different situations that they're looking for. But yeah, field every call, lean on your mentors to make, certain connections for you, because you might sneak in to like a really good program and they won't have known about you otherwise. And, that's one strong reference that you have in your pocket that, that could ultimately bail you out. I would be open to every opportunity. Because I was scared of moving like 8 hours away from home, but ultimately I chose North Carolina. I'm from Pennsylvania, and it's probably one of the best decisions I've ever made. What other advice? Yeah, just being open.
Would you do something differently? Sorry, I don't mean to interrupt. When you said that, though, that piqued some curiosity. Would you do something differently in selecting your externships? Because I know you said you kind of stayed very regional in externships.
I think that's something I had to go through to figure out that the Northeast was not for me. But I mean, how many people extern at places and end up at those places that they rotate at? It's got to be, it's a good amount, no?
Significant. Yes.
Significant amount. So what was your question?
Would you change how you thought about externships, or would you still kind of stay in a more regional fashion, but rank more of them? Or would you actually go a little bit more diverse in locations to give more variety? Because you said it was actually a really great experience to move away, which I actually found the same thing. I also stayed very regional in my again, in full transparency, stayed very regional in my residency externship experience, and ended up choosing a place far away, and was so glad that I did, but I wouldn't have even had the exposure to it had I not done an externship there. So I was just curious if maybe, again, not as a regret, but just if having that experience would have changed anything looking back.
Yeah, I had a weird year because it was a COVID year.
Yeah.
I think I only had five externships.
Okay.
It was 6, but the 6th one didn't offer me an interview. And so it was that awkward period of trying to like leave, despite, putting rent into a place for a month. just trying to leave peacefully. Um, I don't think we get enough at that time. I definitely wish I had more. And I think people have to be more strategic about picking places, because saying that your first one is like your practice one or whatever is not the best strategy. I think if you go somewhere and they like you, they like you.
Mm-hmm.
I think that because I've seen plenty of strong students in their first month.
Oh, for sure.
Like not everybody's great their first month, but
Yeah.
if you're able to make a good impression,
Mm-hmm.
I think you've got a good chance of going to a place.
You mentioned earlier you felt like you were getting bailed out, but I will tell you the mindset of students since COVID is very similar. I think very few students are ranking more than 10 programs. Usually it's around 5 or 6, knowing full well that there's going to be wonderful programs, just tremendous training opportunities for the MP2, which is a secondary match. So I think that there's some strategy there for students. They say to themselves, these are the places I want to go. I'm only going to rank them where I really want to go, and I'm just going to let the chips fall. And if they end up scrambling or going into the MP2, as they call it, they end up with phenomenal programs also. So I don't think your mindset is off. And I think we see that year in, year out. Although, Joe, this year, I think it was 92% of our students at the Arizona College got either their first or second choice. And to your point, they were programs typically where they worked hard and went and did externship, clerkship.
Right.
So I think there's a lot of ways to skid the cat.
Yeah, I think so. I did tell some of my underclassmen the strategy, and it did work for them.
Which strategy?
And I think that's fair, because I think there's certainly something to be said. You go somewhere, you spend a month there, and the whole part of the externship is a two-way process, right? The program's trying to learn how you are, and you're wanting to learn, like, do I want to be here? Do I see myself here? And if you know as a student, this doesn't resonate with me as a learner, I don't think I will thrive here, I don't think I will do well, in this kind of an environment, then I wouldn't rank that program either, because I would rather scramble and take a chance than go somewhere that I already know this one just isn't for me. And I don't think there's anything wrong with that. It's just you are assuming a different kind of risk, right? And I think every person has their own threshold and tolerance maybe for that kind of risk. So I think it's interesting that you've had some junior mentors that or students that you've talked to, and some of them maybe that has also resonated with. So I think there's a lot of ways to approach that, and I appreciate you talking about it, because I just know when I've talked to students in that moment, there's just so much fear about what's going to happen. The uncertainty level is so hard for us to accept. And the first thing I love that your first thing is just take a breath. Like, it's going to be okay. It's going to get figured out. And a lot of that does have to do with, right now, we have a surplus of programs. So there is a little bit of assurance there that I think makes it a little easier to accept that kind of risk, which again, over the next couple of years, we'll see how that changes if things change and we have less programs. But for now, that's certainly an advantage for our residents.
Yeah, I think it's kind of a blessing that we have a surplus. Yeah, that was the strategy I was talking about, Jeff. Yeah. It was, you rank the amount you're comfortable with, and you just kind of roll the dice after that.
Mm-hmm.
Well, I've had students call me after the match and say, Dr. Jensen, I matched with a program I don't want to go to. And naturally I said something like, did you rank them? And they said, yes. And I said, what are you going to do? Yep. Right. So while we always do rapid fire questions at the end of our interviews. And so we thought we'd ask you a few questions. There's no right or wrong answers, just whatever you want. And okay. Joe, I'll kick it off. I mean, you already kind of led us down the path of OR tunes. So what is your music of choice in the OR?
So there's a playlist on Spotify. It's called Big Booty Mix.
Oh, boy.
there's 25 volumes.
Holy cow.
Big booty mix.
Correct.
25 volumes.
25 volumes.
Fantastic.
It's by
That'll
two
keep you
friends.
going.
It's by two friends, and it's got something for everybody, I promise. And then I'm a big fan of Taylor Swift, but my director doesn't let me play her in the OR. So once it's my show,
he's a hater.
I'll get to play all the Taylor I want.
There you go. On your last day, you can play the haters gonna hate line as you walk out.
I'll do that.
I love it. Your turn, Joe.
All right. So tell us, if you were to go out anywhere for dinner, anywhere in the world, what kind of food would you pick and why?
Sushi, because I think it's got that certain type of mastery and it's not too heavy, and you can have like 20 courses and not be full and have just that kind of variety. I love that. I just took my kids to sushi. I love that kids eat sushi, by the way. That's new to me, but apparently they do. So that's like very Anthony Bourdain of your kids. Yeah. Well, my kids are a little weird anyway, so we'll chalk it up to that. But I can be down for eating sushi. So that's what they want. It was expensive, but they did a great job. So
I had sushi for Father's Day yesterday. That was my choice.
Nice. Yeah.
So, there you go. All right, my turn.
Yep.
You're going on vacation for a week anywhere. Where are you going? For a week. I really like Disney. Oh, are you going to the Western? I'm not. Maybe when I'm on the West Coast, I'll be very keen on going to the Western. But yeah, my girlfriend her family has the Disney Vacation Club. Oh. Yeah. And have you heard of Aulani? Yes. It's like my favorite place in the world. I want to go so bad. I've never been more relaxed in my entire life. Oh, that's awesome. So between Hawaii and Orlando. Love it. All right. So then, that takes me out so many different roads. I might have to do a new Dean's Chat question. What's your favorite Disney movie? In spirit of the Western. I really like Moana. See the new one? She's a new one too. Yeah. She's delightful. And she's not a princess or anything. She's headstrong. Yeah. She's the daughter of the chief. And it has fabulous music. Lin-Manuel Miranda did the soundtrack, and it's outstanding. So yeah, he's super talented. Yeah. Oh my gosh, that's interesting. He's a Hamilton, fame and fortune. Yep. He's the Hamilton guy. Yep. You know, Joe, we do all these Dean's Chats, and I learned so much. I learned about Marvel. Now I'm learning about Disney. I appreciate it. It's great. So what do you see yourself doing in 10 years? Why? In 10 years, I hope to do something like Bones Pro Bono. Oh, yeah, yeah. Yeah. That's ultimate my goal. Do you know Brian or Glenn? No, I've never met them, but I mean, okay. I've heard them talk about things, and he's got a good YouTube channel for education. Yeah. But no, I've never met them. Yeah. Glenn's an eclectic guy. He's got lots of interests, and hats off to him. I think I saw recently on social media, T Win from California let Glenn use her C-arm when he made his trip to Vietnam. I don't know if you saw that. The portable one. I did see that. I thought that was exceptional. Like, such amazing collaboration we have. And that's that's so cool. Yeah. Absolutely. All right. Why? Any last words on your end? I just want to thank you all for having me. This was, like you said, super informal. This was great. I'm glad I was able to talk about the scramble and my experiences in my training. And I hope somebody got some interest in the profession somewhere. Oh, I'm sure they did. And thank you for making time. I know you're busy in your fellowship, and we appreciate it, certainly. Joe, any last words on your end?
No, thank you so much. Again, we know, especially this time of year, I think you had mentioned you have 6 weeks left. So there's a lot of things moving in your life right now. And we really appreciate you taking the time to share about your fellowship experiences, your residency, and definitely the vulnerability of talking about what it feels like to go through a scramble and how maybe it might be actually a tactic or a strategy that students can use and not feel so overwhelmed or alone in that process. So thank you so much for taking the time today.
Yeah, absolutely.
Juan, we're going to send you a Dean's Chat mug to get your morning going, right? Start your day the Dean's Chat way, Joe. I'm jumping all over that.
That's right.
All right. Thanks again. And Joe and I will continue to bring you leaders in our profession, whether they're students, residents, fellows, young practitioners. To all of our listeners out there, if you're listening on Spotify or Apple, please give us a 5-star rating. Of course, if you're watching on YouTube, please become a subscriber. And until next week, everybody, cheers.
Cheers.